being performed or for an incorrect diagnosis. I do not believe that that happens in contemporary obstetric practice. Genetic diagnoses are black and white. Some people mistake screening tests for diagnostic tests. It is possible that a screening test that assesses a patient's risk for having a baby with Edwards syndrome or trisomy 21 may say there's a high risk. That doesn't mean the fetus has the condition. We would never suggest or see a woman travelling for pregnancy termination for a risk of a condition. We would always recommend 100% of cases that a patient would have a formal diagnostic test done, like an amniocentesis or a CVS. So that does not get the diagnosis wrong. It does not happen in that situation. In terms of ultrasound, structural abnormalities diagnosed by an ultrasound, we are very careful in our counselling with parents as to the accuracy of what we see and the limitations of what we see. So commonly I will say to a patient, there's an abnormality with the heart, there's a hole in the heart, the blood vessels are lined up in such a way, but that's what it looks like to the best of our knowledge. Or there's an abnormality of the brain, but I can't tell you exactly what effect that will have on brain function. So we always express the limitations of the diagnostic test. If it's 100% certain, we will say that. If it is just a set of findings and we don't know what it means, we'll also say that. So there's no question of people having pregnancy terminations for a wrong diagnosis. Impact on parents travelling, very difficult to specify that because it would be very useful to have longer-term follow-up questionnaires, studies done of depression scores, anxiety scores afterwards. My own gut feeling is there are significant long-term effects from the trauma of travelling. It's very hard to differentiate or to distinguish between what the subsequent anguish, how much of that was due to the original diagnosis, which is understandable, or how much was added to by the subsequent practical challenges. We don't have any data on that, so I can't give you a direct answer as to how often that happens. My gut feeling is it's common.